Dr. Michael Ryan with Missouri Vein Care discussing when an athlete may want to get a vein condition sorted out or treated. It's interesting what I've seen in my practice with treating people with vein conditions is when athletes come in, athletes have a special awareness of their physical body. They actually are able to observe things about their performance that the average person doesn't notice until it's far advanced. In other words, an athlete will begin to notice their performance is trailing off, or their exercise routine is now having to be modified much sooner than an average person who is trudging through their activities and their vein condition is getting worse and worse, and it takes 6 months, a year, 2 years before finally they can't take it anymore, and they come in and get evaluated. Athletes often will come in quite a bit earlier than that because they notice that there's something not right, and I've seen it a number of times. They'll say, I can't keep up with my pack mates in my bicycling group. I'm now trailing behind, or something not right. Others will say, during their weight routine. I remember one young lady said, there's something not right because I can't do my workout the way I used to. There's something not right. I remember one lady who was very tall, thin, runner's physique, and she had a giant ropey vein going down her leg, which had been there for probably 10 to 15 years. Those don't pop up overnight. And she was a runner, and she ran 10Ks and half marathons and that kind of stuff. And I looked at her leg and I said, this has been here for 10 or 15 years. She said, you're right, it has. I said, why are you just now deciding you want to get something done about this? And she said, well, I'm having trouble with my training, and I don't think I can compete anymore. I'm ready to give up running because I just can't perform at the level I'm used to. I can still run, but I'm kind of jogging. So she had noticed in the last 6 months this decline in her performance. So the long story short with her is that she had a treatment, and literally 3 weeks later I saw her and in a follow-up visit, and she said, I did a half marathon and I had my personal best. And I went, there you go. The lady knew her body. So athletes will often know that there's something not right with their circulation, and the symptoms are usually reduced performance, fatigue in their legs, a feeling of heaviness, their ability to bounce back from interval training. In other words, they need more recovery time is going to go up. And then also the cycle of the vein condition is always worse in the evening, and if they are trying to do their workouts in the evening, they're going to notice it a lot sooner than people who do their exercise and workouts in the morning, because the cycle of a vein condition is as the stagnant circulation in the veins is building up during the day, it allows inflammation to build up in your body, which is what is kind of a poison to your exercise capacity. And that peaks in the evening. So for people that exercise, athletes that exercise in the evening, they're going to notice it a lot quicker than people that exercise, athletes that exercise in the morning, because overnight the inflammation will clear out of the body. So those are some observations I made about athletes, and the good news is that they get significant improvement in how their legs feel and also their performance. So vein treatments really do help from that perspective. So Dr. Michael Ryan discussing athletes and vein condition.